I would like to thank Brenda Johnson for sending me this story, which came out in the New York Times, April 6th, 2019. I actually saw this last week and I read a little bit up on it. And, it's shocking, but then it's not shocking that it's not really being revealed. But there are many strains of germs that simply cannot be treated with meds or antibiotics. They're like super viruses, super germs. And this is definitely one of them. Last May, an elderly man was admitted to the Brooklyn branch of Mount Sinai Hospital for abdominal surgery. A blood test revealed that he was infected with a newly discovered germ. As deadly as it was mysterious, doctors swiftly isolated him in the intensive care unit. The germ, a fungus called Candida auris, preys on people with weakened immune systems, and it is quietly spreading across the globe. Over the last 5 years, it has hit a neonatal unit in Venezuela, swept through a hospital in Spain, forced a prestigious British medical center to shut down its intensive care unit, and taken root in India, Pakistan, and South Africa. Recently, C. auris reached New York, New Jersey, and Illinois, leading the Federal Center for Disease Control and Prevention to add it to a list of germs deemed urgent threats. Wow. The man at Mount Sinai died 90 days in the hospital, but C. auris did not. Tests showed it was everywhere in his room, so invasive that the hospital needed special cleaning equipment and had to rip out some of the ceiling and floor tiles to eradicate it. Everything was positive: the walls, the bed, the doors, the curtains, the phones, the sink, the whiteboard, the poles, the pump, said Dr. Scott Lauren, the hospital's president. The mattress, the bed rails, the canister holes, the window shades, the ceiling, everything in the room was positive. C. auris is so tenacious in part because, okay, what it is saying, it is I believe, probably in a video last year, I told you guys I was hospitalized and I had some surgery done, and I actually picked up a super virus, and it took an entire year to get rid of it. It's surprising that it didn't kill me because the doctor kept switching the antibiotic, and finally they had to take me back into the OR to remove it. And then I had to go on a continuous antibiotic drip for 4 days in a row. And then I was released from the hospital. So I know how deadly this can be, and it's scary. C. auris is so tenacious in part because it is impervious to major antifungal medications, making it a new example of one of the world's most intractable health threats: the rise of drug resistant infections. So I guess this is the disease on a slide. Wow. For decades, public health experts have warned that the overuse of antibiotics was reducing the effectiveness of drugs that have lengthened lifespans by curing bacterial infections, once commonly fatal. But lately, there's been an explosion of resistant fungi, as well as adding a new and frightening dimension of a phenomena that is undermining a pillar of modern medicine. It's an enormous problem, said Matthew Fisher, a professor of fungal epidemiology at Imperial College London, who was a co author of a recent scientific review on the rise of resistant fungi. We depend on being able to treat those patients with antifungals. Simply put, fungi, just like bacteria, are evolving defenses to survive modern medicine. Yeah, they're constantly changing and replicating themselves. So, therefore, the medicine is just not keeping up with all of the changes that these viruses and fungi are making. So, it's hard to pin down one medicine when the thing is constantly changing. Yet, even as world health leaders have pleaded for more resistance in prescribing antimicrobial, bile, antimicrobial drugs to combat bacteria and fungi, convening the the UN General Assembly in 2016 to manage an emerging crisis, gluttonous overuse of them in hospitals, clinics, and farming has continued. Resistant germs are often called superbugs, but this is simplistic because they don't typically kill everyone. Instead, they are most lethal to people with immature or compromised immune systems, including newborns and the elderly, smokers, diabetics, and people with autoimmune disorders who take steroids that suppress the body's defenses. Wow, that is scary. That is really scary. You know how many people could be impacted by this worldwide? A British a study, the British government funded projects that if policies are not put in place to slow the rise of drug resistance, 10 million people could die worldwide of all such infections in 2050, eclipsing the 8 million expected to die that year from cancer. In the United States, 2 million people contracted resistant infections annually, and 23,000 die from them, according to the official CDC estimate. The number was based on 2010 figures. More recent estimates from researchers at Washington University School of Medicine put the death toll at 162,000 worldwide for fatalities from resistant infections are estimated at 700,000. Wow. They don't tell you nothing in the US. You know, instead of telling us something life threatening like this, they'd rather sit on TV all day long talking about Jussie Smollett. I don't even care about him, not like that. But anything that could take their life, they don't want to hear about that. With bacteria and fungi alike, hospitals and local governments are reluctant to disclose outbreaks for fear of being seen as infection hubs. Even the CDC, under its agreement with states, is not allowed to make public the location or name of hospitals involved in outbreaks. Why? They don't care about public safety at all. They don't give a shit about us. State governments have, in many cases, declined to publicly share information beyond acknowledging that they have had cases. All the while, the germs are easily spread, carried on hands and equipment inside hospitals, ferried on meat and manicured, fertilized vegetables from farms, transported across borders by travelers, and on exports and imports, and transferred by patients from nursing homes to hospitals and back. That almost makes it virtually impossible not to get it, doesn't it? I mean, wow. CRS, which infected the man at Mount Sinai, is one of dozens of dangerous bacteria and fungi that have developed resistance. Wow. Other prominent strains of the fungus Candida, one of the most common causes of bloodstream infections in hospitals, have not developed significant resistance to drugs, but more than 90% of C. auris infections are resistant to at least one drug, and 30% are resistant to two or more drugs, the CDC said. Well, that makes it very dangerous, doesn't it? Dr. Lynn Sosa, Connecticut's deputy state epidemiologist, said she now saw C. auris as the top threat among resistant infections. It's pretty much unbeatable and difficult to identify, she said. Sounds like the Most High is really working, isn't it? I mean, seriously, how do you just come up with a disease like this and it's spreading globally and they're admitting that they are defeated by this thing? Only the Most High could create such a thing. Nearly half of patients who contract C. auris die within 90 days, according to the CDC. Yet the world's experts have not nailed down where it came from in the first place. Sound like the Most High's at work, y'all. It is a creature from the Black Lagoon, said Dr. Tom Chiller, who heads the fungal branch at the CDC, which is spearheading a global detective effort to find treatments and stop the spread. It bubbled up and now it's everywhere. So now it's showing you, ladies and gentlemen, where it is. And you can see Canada and the US, multiple cases of Candida auris infection, where you see the lighter shade, like here in Kuwait. This is one reported case. But look at where it is: the US, Canada, Colombia, Venezuela, Spain, France, Britain, Germany. You can see a little orange there. Saudi Arabia, Kenya, South Africa, India, uh, China, Russia, Singapore, Australia. Wow. So all of these places in the darker orange have multiple cases. And in the lighter shades, they have just one case reported. So for the United States, the country has had at least 587 Candida auris infection since 2013. Never heard of that until I read about it last week. Wow, they're right. It's definitely global. And it says for Europe, the first large outbreak in Europe involved 72 cases in a London hospital, 2015, 2016. India and Pakistan, the two countries have some of the highest cases counts in the world. A distinct strain appeared in Pakistan as early as 2008 and in Delhi by 2009. All right. In Japan, they're saying Candida auris was discovered in 2009 in the affected ear of a 70-year-old Japanese woman. No need to tell the public. Well, I disagree. I think the public need to know. You know how many people need to go to hospitals and be treated for many things. So when you got this thing around and you're not telling somebody, I think that is the wrong message to send y'all. This is quite long, and what I will do, I'll leave the description to this in the description box, and you can come out in your own leisure and read about this. But this is scary. Coming to America in the United States, 587 cases of people having contracted C. auris have been reported, concentrated with 309 in New York, 104 in New Jersey, and 144 in Illinois, according to the CDC. The symptoms, this is what I want to see. Fever, rashes, and fatigue are seemingly ordinary. But when a person gets infected, particularly someone already unhealthy, such commonplace symptoms can be fatal. So, fever, rashes, and fatigue. The earliest known case in the United States involved a woman who arrived at a New York hospital on May 6, 2013, seeking care for respiratory failure. She was 61, from the United Arab Emirates, and she died a week later after testing positive for the fungus. At the time, the hospital hadn't thought much of it, but 3 years later, it sent the case to the CDC after reading the agency's June 2016 advisory. So they're showing you on the map where there were cases. Sorry about that, y'all. Wow, this is crazy. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.